right at 3, so we're good.
Okay. So I'm going to knock knock, enter the room, close the door for privacy, wash my hands. Hi, my name is Sarah. I'm going to be your nurse for today. Can you please state your name and date of birth? I have Carl Rogers, date of birth 3/15. Do you have any allergies, Mr. Rogers? He states that he does not, and he is also not wearing an allergy band. I'm going to verify the MR number 771-8854, 771-8854. Okay. All right, Mr. Rogers, we're going to be doing a full head to toe assessment today. I'm going to start off with taking some vitals. So here on the monitor, I have a blood pressure reading of 148/79, a heart rate of 91, and 96% room air for O2 sats. You put this under your tongue. It's reading a 99.9, and I'm going to take your respirations here for 30 seconds. 30 seconds has passed, and I have respirations at 18. Okay, are you in any pain today, Mr. Rogers? He states yes, he is. On a scale from 1 to 10, how would you rate your pain? He states a 3 out of 10. Can you tell me where that pain is located? And he says his right heel. Is your pain is your pain radiating or not radiating? He states is non-radiating. What makes your pain better? He says that pain medications do make it better, and just being able to be comfortable to get enough rest. And what makes it worse? And he says touch. Okay, do you know where you are today, Mr. Rogers? He states that he is at Fortis Hospital. Do you know why you're here? For your hyperglycemia and also for your wound on your heel. Yes. And do you know what date it is today? He states that it is 5/28. Good. So the patient is alert and oriented times 4. I'm going to shine this in your eyes. Okay, and follow the pen light. All right, so pupils are equal, round, and reactive, and they're able to accommodate. Can you stick out your tongue for me? Oral mucosa is pink, moist, and intact. I'm going to check for skin turgor, and the skin is non-tenting. Okay, Mr. Rogers, have you had a cough? He states that he has had a cough. Are you able to cough up anything? He states yes. Okay, and then what color is that? He states that's white. And the consistency, he states that it is thin and frothy. Okay, if you could cough up into a little medicine cup, about how much do you think you could cough up? And he states 5 milliliters. Okay, so I'm going to listen to 8 places on the front and 10 on the back. I'm going to inspect the chest, and the chest rises symmetrically. Okay, respirations are unlabored. They're even and unlabored, and I do hear some fine crackles in the lower lobes of his lungs. Okay, so now I'm going to listen to your heart, starting with the second intercostal space to the left, or the right, which is the aortic. S1, S2. Second intercostal space to the left is the pulmonic. S1, S2. Third intercostal space to the left is Erb's point. S1, S2. Fourth intercostal space to the left is tricuspid. S1, S2. Fifth intercostal space, midclavicular line. S1, S2. I'm going to flip this over and listen to the apical pulse for a full minute. And a full minute has passed, and I have the apical pulse at 92 beats per minute, and it is regular. Okay, I'm going to assess your brachial pulses. They are +2 and regular on both sides. Radial pulses are +2 and regular on both sides. I'm going to check for capillary refill, which is less than 3 seconds on both sides. Can you squeeze my hands and push down and pull up? And the bilateral upper extremity strength is a +5. Okay, you do have an IV site. I'm going to assess it. There's no redness, swelling, or infiltration. The dressing is clean, dry, and intact, and it is also dated for today. So I would flush it just to check for patency to see if it's working, and it is. Okay. All right, Mr. Rogers, when was your last bowel movement? He states it was last night. Okay, and what was the color of that? Brown. Okay. And the consistency, you say is soft. Okay, was there any unusual odor? There wasn't? Okay, and then what was the size of that? He states was medium in size. Okay, so I'm going to inspect the abdomen. The abdomen is flat and non-distended. I'm going to listen to 4 quadrants, starting in the lower right quadrant. Vowel sounds are active. Upper right quadrant, vowel sounds are active. Upper left quadrant, vowel sounds are active. Lower left quadrant, vowel sounds are active. Okay, so now I'm going to palpate, and can you tell me if you have any pain or tenderness in your abdominal area? Right lower quadrant, no. Right upper quadrant, no. Left upper quadrant, no. And left lower quadrant. So the patient denies any pain or tenderness when palpating. Okay, Mr. Rogers, when was the last time that you used the bathroom? Says that he doesn't know. Can you tell me what the color was? He said it was a straw color. The clarity, was it clear, was it cloudy? He states that it was clear, and that there was no odor. And about how much did you fill your urinal up with? He states half of a full urinal. Did you have any pain, urgency, or frequency? He states that he did not. Okay, so I'm just going to assess your genitalia. So I'm just going to lift up the gown. There are no lesions, edema, abnormalities, discharge, or sores. So I put that back down. Okay, I'm going to go down to the legs here. Check for edema. There is no edema present. The skin is warm to touch, it's dry. The color is appropriate to ethnicity. There are no lesions or presence of any breakdown. I'm going to wash my hands, put on some gloves, and move down to the feet. Okay, so I'm going to start by assessing the dorsalis pedis pulses on both sides. And they are +2 regular. Posterior tibialis pulse is a +2 and regular. Checking for capillary refill on both sides, which is less than 3 seconds. Can you push down for me and pull up for me? Okay, so I'm going to take my gloves off and wash my hands. Okay, and then at this point, I'm going to assess your wound, and looking at the wound, it is 1.25 centimeters by 1.25 centimeters. There is scant purulent drainage on the dressing, and we will get that changed for you, okay? All right, so we are all done for today. Is there anything else I can do for you? No? Okay, so I'm going to put the bed down, the rails up. Here is your call bell if you need anything. I'm going to wash my hands and exit the room.